Pranam, Dr. Manjunath here. As a part of knowledge series of Grow Excel Vet Private Limited, last week we streamed on inclusion body hepatitis. This time, Professor Srinivas Gowda, in continuation to that, will be speaking on inclusion hydropericardium syndrome. Very pioneering work on hydropericardium syndrome was conducted by Professor Srinivas Gowda during 1994 itself. Next slide, please. No need to introduce Professor Srinivas Gowda, as he is a very, very renowned pathologist. Everybody knows about him. Anyhow, as a formal introduction, he was a founder, vice chancellor of KVAFSU, Bangalore and Mangalore, former director of IAH and VB, former professor and university head department of pathology. So guided 40 PhD students and many PG students. So again, I am telling my guru, Professor Srinivas Gowda, his contribution to this industry is invaluable. Over to you, sir. We will discuss on.
Thank you, Dr. Manjunath. Today we are going to discuss about adenoviral diseases, and there are good number of adenovirus diseases are affecting the poultry industry. Last time we discussed about the inclusion body hepatitis, which is one of the re-emerging problem in the poultry industry. And similarly, number 2 in the series is hydropericardium syndrome, which is also a re-emerging. Although it has started in 1994 in India and Pakistan in 1987, and then it has come to India in 1994, and this has spread throughout the country, and it has baffled the entire poultry industry, and it has made heavy loss to the poultry, particularly broiler industry. See, that's the importance of the adenovirus. And my talk is going to be having this plan of presentation, introduction, prevalence, cause, clinical science, postmortem findings, diagnosis, vaccination and treatment, prevention and control, and conclusions. So now, in this, what are the unique features of this, the hydropericardium syndrome or hydropericardium hepatitis syndrome? Hydropericardium hepatitis syndrome is an emerging problem in the broiler industry world over, with a sudden onset in a well-grown broilers and occurs in 3 to 4 weeks, 5 weeks old in a well-grown broiler flocks. It is characterized by acute onset with an incubation period of 24 to 48 hours. That means within 48 hours, almost heavy mortality up to 75 to 80% is going to happen in the poultry industry. It's a very characteristic feature of hydropericardium, enlarged motile diffuse hepatitis, liver, and pulmonary edema of the nephritis also is the thing. Something we have to talk about what are the names called by on this disease in different parts of the world. Hydropericardium syndrome is called as Angara disease in Pakistan, which is occurred in 1987 to 1988, and Lychee heart disease in India in 1994, and the rest of the world it is called as hydropericardium hepatitis syndrome. I think this picture gives you all the 3 important diseases of this adenovirus. And the cause is the adenovirus belonging to serotype 4, a non-enveloped DNA virus is commonly seen among the 12 serotypes. Transmission, it is highly pathogenic and contagious disease. Transmitted horizontally also, and it's also transmitted vertically also. So it can see, it starts from wildlife, and from wildlife to chicken to horizontal infection, and then vertical infection. So therefore, it spread rapidly from flock to flock in the farm if the white birds are there. What are the predisposing factors? If your farm is having subclinical infection of immunosuppressive viruses like IBD, chicken infectious anemia, and Marek's disease, and bacterial toxins, particularly Clostridial toxins and mycotoxins in the feed, and from wild birds. If they frequently they are visiting the wild birds from different parts to the poultry farm, and it transmits vertically from parents to hens also. Wherever the poor biosecurity is there, it is one of the causes for development of this disease or spreading of the disease is very fast. What are the clinical signs? Mainly, the birds are reluctant to move, shows lethargy, and tend to gather in a corner and huddling together with ruffled feathers. Loss of appetite, mucoid yellow or whitish droppings, reduction in weight gain, birds remain active till death, and in terminal stages of the infection, the chicks will be dull, depressed, and ruffled feathers. This is the very typical. Within 24 hours, the birds develops very good birds, very actively. They will be moving around, but suddenly it starts, and within 48 hours, the disease spreads to the entire flock, and the mortality ranges between 70 to 80%. So postmortem, if you conduct the postmortem, you can see very typical liver is enlarged, congested, friable, and a dark magenta red color, and with a particular images on the liver, and sometimes the liver is pale also, you can see here, and with the very typical the heart. When they see the typical heart, the typical picture is accumulation of straw-colored jelly-like fluid in a pericardial sac up to 20 ml clear straw-colored fluid observed in the pericardial sac, giving a balloon appearance. See this picture, it's giving the shape of balloon, and it is also very clear fluid which is accumulated around the liver, and the pericardium. So that is one of the characteristic feature. Therefore, yes, it's called as hydropericardium syndrome. And in the lesions, heart lesions particularly, it's a lychee fruit appearance. Just see this. It's a typical lychee fruit appearance, hence the name lychee fruit disease also in India. And in the kidneys are swollen, friable with urates, and tubules are engorged with sometimes urates. See this? This is the enlarged kidney. And in the lungs, normal lungs, when you compare to the normal lungs, it's a red color and it's a common and it's not enlarged. But here the lungs are engorged with a fluid effusion. That is the thing, because the entire body will have a fluid effusion. So diagnosis is very simple, mainly postmortem changes, and also a classical sudden onset of the disease with high mortality, characteristic lesions, demonstration of hydropericardium, enlarged motor liver, pale kidneys, and then laboratory you can isolate the virus, and molecular techniques also can be used. PCR techniques and restricted endonuclease analysis also is commonly used in this. And what is the preventive methods? See, there is no treatment for this disease as other viral diseases follow it. Antibiotics sometimes may help to avoid secondary bacterial complications, and liver tonics to be to recover birds. Some of the recovered birds can give the liver tonics, and they will come out. By using proper vaccinations, autogenous vaccines are commonly used in commercial broiler chicks, and also serotypes 4 and 8 is commonly used. In breeder vaccination is very important, and it is again autogenous inactivated vaccines to ensure the transfer of maternal immunity from breeding flock to the progeny, and it provides a protection against field infection and the clinical disease in the broilers. So high biosecurity, good biosecurity practices can prevent the spread of the infection. And in conclusion, it is a highly pathogenic to the chicken, highly contagious, and spreads very fast in the flocks, and it causes heavy economic loss because of the heavy mortality. It occurs as a re-emerging in endemic areas. Here and there we are seeing this problem even now. Stopping the shedding of the virus to the environment is by particularly vaccination programs to the parents to stop the vertical spreading, and also to the horizontal spreading also. So strict adoption of biosecurity is very important to control this disease. Thank you. My acknowledgements to all my PG students who have worked on this hydropericardium syndrome under me, and thank you for your patience time listening to this talk. Thank you.
Thank you, sir, for your intention to part the knowledge to the industry. And when the authority speaks, it makes a meaningful discussion. Thank you so much.